Hello everyone, I am Dr. Aparna, consultant neonatologist at AIIMS Cuddles Hospital, Kondapur, Hyderabad. Today we are going to discuss one of the common conditions that newborn babies often have, and that is neonatal jaundice. Jaundice is nothing but the yellowish discolorization of the skin, eyes and gums of the newborn baby because of the elevation of a pigment called bilirubin. Most babies have some degree of jaundice, almost 60 to 70%, and a lesser proportion of babies may require treatment when jaundice levels reach a significant value. You may have wondered, why is jaundice so common in newborn babies unlike adults? There are multiple reasons for this. Newborn babies are generally born with a higher red blood cell volume and load, and when these red blood cells are normally broken down by the body, they tend to have higher levels of bilirubin, which is produced during this process. In addition, some babies may have added risk factors for developing neonatal jaundice in the form of bruising over the skin. There may be swelling in the scalp because of the process of birth, which is called as hematoma, which is formed during the normal delivery or sometimes post a cesarean section also. Some babies may develop jaundice because of the difference in the blood group between the mother and the baby, like when the mother is O positive and the baby is A positive, or if the mother belongs to a Rh negative blood group and the baby has a Rh positive blood group. In some cases, jaundice may develop because babies may lack some enzymes which are necessary for the removal of this bilirubin from the body. One of these enzymes is called G6PD, glucose 6-phosphate dehydrogenase. So there are multiple reasons why a newborn baby can have exaggerated level of jaundice, which to a certain extent is a normal phenomenon also. In general, jaundice presents or manifests in the form of yellowish color developing over the baby's skin, the eyes, that is the sclera, as well as the gums. Very often, when the levels of bilirubin start rising in the blood, the yellowish color starts evolving or spreading from the baby's face towards the baby's palms and the soles. Although, as I told you, most babies can have some level of jaundice, we also need to remember that jaundice which arises or which is seen very early in life, that is within the first 24 hours of the baby's birth, or jaundice which is involving the baby's palms and soles, is almost inevitably abnormal and it requires immediate medical attention. So it's also important for us to know when to identify that jaundice is now very significant or potentially problematic. If the baby has signs of poor feeding, poor breastfeeding, poor sucking, decreased activity, is excessively sleepy, difficult to wake up, or is excessively irritable and constantly crying. And as I told you earlier, if the jaundice levels or the yellow color of the skin is involving the baby's palms and soles, or if jaundice started very early in life, that is within 24 hours of birth, or if jaundice persists for more than 2 weeks after the baby's delivery. All these are signs that jaundice is potentially problematic and requires further medical evaluation and treatment. So when you go to the doctor taking your baby with suspected jaundice, the doctor would generally advise you a test for assessing the level of serum bilirubin. This can either be done with a skin test or with a blood test. Skin test, which is done by transcutaneous bilirubinometer, is a way by which the jaundice levels in the baby's body can be determined by looking at the skin deposition of this bilirubin pigment, and this is fairly reliable when the jaundice levels are not very high, that is when the levels are not more than say 13 or 14 milligrams per deciliter. The skin level kind of loses its accuracy when the jaundice levels are very high, and in that situation the doctor may recommend your baby to go for a blood test. Blood test is generally done by taking a venous or a capillary sample for testing for what we call as serum total bilirubin levels. This remains the gold standard or the most accurate test for determining the exact levels of bilirubin elevation. Once you have a serum bilirubin level, the decision of whether this is to be treated by hospitalizing the baby and giving phototherapy or whether this can just be managed at home will be decided by your pediatrician. Once a diagnosis of significant jaundice is made based on the assessment of bilirubin levels, most often by a blood test, then a decision is taken whether it requires phototherapy. This decision is made not only based on the level of jaundice but also in consideration of the baby's additional risk factors such as the number of weeks of pregnancy, what we call as gestational age of the baby, the other additional risk factors like whether the mother and the baby belong to different blood groups, whether there is any additional risk factor like excessive sleepiness, drowsiness, decreased protein levels in the blood, whether the baby also has G6PD enzyme deficiency, whether there is excessive bruising over the baby's skin or whether there is a hematoma on the scalp formed during the process of delivery, etc. etc. So based on the value of bilirubin and also in consideration with all these multiple factors in mind, the doctor generally incorporates the baby's level into standardized charts which are available or nomograms which are available based on the baby's postnatal age or age in hours from birth, and then a decision is taken whether to treat bilirubin. So it's not a simple decision which is taken just with a value in mind. Phototherapy is the gold standard or the most scientific accepted method of treating jaundice. This is a technique wherein specialized bluish green lights of a certain specific wavelength are placed over the baby's bed, and sometimes you may find these lights placed both above and below the baby's bed, and this light converts the bilirubin which is there in the baby's skin and the baby's blood circulation to harmless products which can be easily removed from the baby's body by urine and stool. While giving this phototherapy, the baby needs to be monitored closely. So typically phototherapy is only given in the hospital. In some countries it may also be given at home, ensuring that monitoring is done very closely. So one needs to monitor the baby's activity, the baby's feeding status, the baby's hydration. So whether the baby has adequate fluid balance in the body and how the baby is breathing, whether the baby is maintaining temperature, etc. It's very important to ensure good hydration during phototherapy because unless the baby passes good urine and stool, the breakdown products of bilirubin will not be effectively removed from the baby's body. While giving phototherapy, the doctors also will take some additional precautions which involve covering the baby's eyes with an eye bandage in order to prevent any effect on the retina, and in male babies it's important to cover the gonads or the baby's genital organs during this process. So ensuring that the maximum possible surface area of the baby's skin is exposed to phototherapy. It is also important to maintain phototherapy continuously, minimizing the interruptions or breaks in phototherapy. In fact, for no other reason other than feeding, the baby should be removed while on phototherapy. Now, having discussed about phototherapy, we also need to remember that there is certain higher specific lines of management for more significant levels of jaundice. So when the levels of jaundice have crossed the level that can be effectively managed with phototherapy, doctors may sometimes resort to a process called as double volume exchange transfusion of the blood. So this involves a process wherein a catheter or a venous line is placed within the baby's umbilical line usually, and the baby's blood is removed in small aliquots and equal volume of bilirubin deplete blood or safe blood is infused into the baby's body by a very specialized team of doctors and nurses. This is called as double volume exchange transfusion. This is done when the levels of bilirubin are significantly high and we feel that it may not be effectively treated within a short time even with phototherapy. In some specific situations where the mother's and the baby's blood group are incompatible, like when the mother is Rh negative and baby is Rh positive and there is also very high levels of bilirubin or jaundice, then we use some specific injections, particularly IVIG, intravenous immunoglobulin, to remove the antibodies that are responsible for the high levels of jaundice. And now let us discuss how can jaundice be prevented. Is there something that you can do as parents in order to avoid the baby to have the effects of very high levels of neonatal jaundice? Yes, the most important thing that families can do is to ensure adequate feeding. If the baby is on optimal feeding, which is breastfeeding right from the point of birth, and if the baby passes good volume of urine and has regular stooling, that is passes stools frequently, then remember that the chances of developing jaundice in the baby is substantially lesser. The role of sunlight therapy, which parents often ask us, is not very scientifically proven. Remember that sunlight also has hazardous radiation like ultraviolet rays, which are not useful in the treatment of jaundice. So, if at all UV rays can be filtered, which has been tried in some scientific studies, then sunlight may have a role in marginally elevated levels of bilirubin, but it is not a scientifically proven technique of routinely treating neonatal jaundice. With this, I would reiterate that newborn jaundice is a common issue and only 15 to 20% normal newborns would require treatment for jaundice. Jaundice can be effectively treated if identified at the right time, which needs a good follow-up by your pediatrician few days after the baby's discharge, and prompt diagnosis with a serum bilirubin or a skin test, optimal treatment in the form of phototherapy and exchange transfusion whenever the levels are very high, and remember that prevention is better than cure, which can be done with optimal breastfeeding. Thank you.